Today I will show a very short case study on retracted soles and pedal bone remodeling. It's not always the case that you have a retracted sole and you start having bone remodeling, but in general, if you have very thin sole and you do not take care of the fact that the sole is thin, you might have a bone remodeling. And not every horses also have good structure, so it's something you really need to have x-rays done on your horses more often than you think, at least once a year. A retracted sole, and you can see in this slide, it's basically the foot went from being very, very hydrated to extremely dry all at once, which happened here. And often when you see those retracted sole, it happens also when you have a pretty thin sole to start with, so that's not a good thing. Again, many cases prolapsed sole, protracted sole develop as a result of pre-existing thin sole combined with environmental changes. When you have hoof transitioning rapidly from very wet environment to a much drier one, leading to an accelerated moisture loss. So basically, it sucks the sole against the pedal bone and squeeze also the corium and probably make it very sore. The foot, which was the case. So one thing, it's not so unusual for horses to have some amount of drop sole. Those are loading issue. I will talk about the drop sole a little bit later, but it's not so unusual when it really start dropping and retracting, and that's really very bad, because basically if you look at the picture on the top, you have more of a corium, and then if you look at the picture at the bottom, it will be compressing. The corium is not shown, but think about something being really compressed. The corium is compressed between the keratinized sole and the pedal bone, and you will have pain, and you can create some rapid pedal bone remodeling. So this is a horse I was working on. The horse is not quote lame. Is under veterinary supervision, so I don't accept horses unless they're under veterinary supervision. The palmar angle is almost 10 degree on the left and 9 degree on the right, and you have a little bit of rotation. The horse was not truly diagnosed as being laminitic, but when the sole doesn't give the support it needs to, it's very painful, and you can cause also bone demineralization. So this is the inverted X-ray, and you will see that actually the pedal bone is badly remodeling on both sides. That's not a normal. The red arrow will show you this is not a normal shape for a pedal bone, and it's hard to tell when it started. It's an X-race horses, so we don't know. I don't have the whole story, but in general, you do not want to see that, especially on a horse that doesn't have sole depths. Hoof can be okay with some remodeling, but if you don't have sole depths, it's, in the long run, or even short term, can create a lot of problem in terms of soundness and even laminitis. So a normal bone on the left, you can tell there's no dip or anything. This is actually a quite nice bone, where you have a remodeled pedal bone on the right, the horse I'm working on right now, with no sole depths, and you can see the difference between one foot to the other. So the thing is, if you measure the sole depths from the corium from the apex of the pedal bone, it's extremely thin. It's 0.9 inches, 0.21 inches, which is not adequate, for a horse. You can see how the green line show where the corium is of the hoof, and you can see actually there's not a lot of sole depths. And as I was saying, when you have a very thin sole and you do not have anything to support the pedal bone, you have all the stress onto the corium, and it will continue creating irritation into the pedal bone and further demineralization with time, or even laminitis. It's not the case with this horse, but it's still a little bit scary. So that's where the both feet look like when I first got it. As far as I'm concerned, doesn't have enough support from the heel to the bulb. So we did lower the heel afterwards when we trimmed. This is after trim. The flare will be taken off even more onto the shoe. I'm not trying to create myself more work, so I set the shoe and then remove more flare. Another thing that's very important to consider is what we call the Palmer metric, which assesses the demineralization in pedal bone by quantifying the concavity of the palmar surface. So in this case, for a 13-year-old horse, it's below normal. Look at the red line, and you can see it's very normal for horses over time to lose vertical depths. But if you start at a 13-year-old that has already pretty flat foot and stuff, it's not very good, because in general the trend will continue with lowering. The palmar metric will get less, so meaning there's less concavity in the pedal bone. You might be able to stop it if you give her the right amount of support. So same thing, the right front, it's not funny, it's a nervous laugh. The right front foot has a similar issue. It's even more demineralized. We have a paper that is explaining how we did this research. So basically, after lowering the heel, I want to support the sole. But again, it's an art, because you cannot just randomly support the sole, and especially when a horse is so thin. So you have to not put pressure onto the sole. But you do need to be very, very careful how you support that foot with, because you will create some problem. I have a method of doing that which has been very, very useful for plenty of problem, from laminitis to thin sole to prolapse sole. So you have to be careful when you lower the heel. You do not want to actually caudally rotate the horse. So I have a small little lift, and I will explain that when I give educational seminar on how it's done. Take a closer look at the light part under the pedal bone, and that's a special material I use to actually alleviate any pressure under the pedal bone till we start having actually a good sole. So again, you have to be extremely careful after your hoof test when you assess if the horse is sore or not under pressure, if it's a hoof tester, to have a plan before you put sole support. As I say, sole support work fantastically well, but you need to be very careful. So I try to support the sole, but I don't want to create stress in the structure that are already stressed, like the corium and the pedal bone. There's probably, if there was a nuclear scintigraphy on this horse, I predict that it will light up under the pedal bone. So I'd be very, very careful on how to support the foot, and that will be explained another time. So this is the end product. Again, no pressure under the pedal bone, as you see. Again, when you have a lot of flare, you are going also to change the locomotion of a horse, but you have a big pancake, the horse is not moving quite right. This is not going to be resolved overnight. I'm pretty sure it's going to be better with time. And you can see the flight pattern when the horse is barefoot with those big flared feet. It's changing, and that's not very good. That doesn't help also healing the foot. So that's it for now.